Good day everyone, I am Chariske Kilakiga, a second year BS Math student. So today I will discuss about the learners with socio-emotional disorder and learners with chronic illness. Before we proceed to our topic, let us read our objective first. So at the end of this lesson, students will be able to define common socio-emotional disorders like emotional behavioral disorder, anxiety attack, depression, obsessive compulsive disorder, and bipolar disorder, also as common chronic illness like asthma, diabetes, epilepsy, and allergy. Identify at least two strategies for adapting teaching methods and materials to meet the diverse needs of learners with socio-emotional disorders and chronic illness in the classroom. Recognize the significance of creating a supportive and inclusive learning environment that respects students with socio-emotional disorders and chronic illnesses, fostering a sense of belonging and promoting their academic and personal growth. Now, let's proceed to the learners with social-emotional disorders. So, learners with social-emotional disorders experience challenges with their emotions, behavior, and so even social interactions that can significantly impact their learning and overall well-being. So, these disorders can manifest in various ways that affect their ability to regulate emotions, build relationships, and even to succeed academically. So, understanding and addressing these needs is crucial for creating a supportive and inclusive environment. So one of the common social-emotional disorders of those learners is emotional behavioral disorder. So this is also termed as emotional disturbance and or emotional challenge. So children with emotional and behavioral disorders um, exhibit one or more five characteristics like the inability to learn that cannot be explained by intellectual, sensory, or health factors, inability to build or maintain satisfactory interpersonal relationships with peers and teachers, and even a tendency to develop physical symptoms or fears associated with personal or school problems. Next is we have anxiety. So this can occur when a person fears that something bad is going to happen. So it has been linked to stress as well as feelings of fear and worry. It often involves physical symptoms such as muscle tension. So anxiety attack is different from a panic attack, which is a symptom of panic disorder. So anxiety attack often relates to a specific event or situation, although this is not always the case. A panic attack, meanwhile, can happen without any specific trigger, and the symptoms are far more severe than the symptoms of anxiety. So, however, levels of stress and anxiety continue for a long time, so further problems may develop. Next, we have depression. So, depression or a major depressive disorder is a common and serious medical illness that negatively affects how you feel, the way you think, and even the way you act. So, fortunately, it is also treatable. So, depression causes feelings of sadness and or a loss of interest in activities you once enjoyed. It can also lead to a variety of emotional and physical problems and can decrease your ability to function at work or at home. So, depression, the symptoms of depression can vary from mild to severe, and this includes feeling sad or having a depressed mood, you're losing interest or pleasure in activities that you once enjoyed, changing in appetite, loss of energy, or increased fatigue. We also have obsessive compulsive disorder or the OCD that is considered a chronic or a long-term mental health condition. So this psychiatric disorder is characterized with obsessive compulsive disorder that is also known to have a variety of symptoms and behaviors that are characteristics of the disorder. So the symptoms of obsessive compulsive disorder may involve the characteristics of obsessions, behaviors that would indicate compulsions, or both. The symptoms is often associated with feelings of shame or even secretiveness. So there are two symptoms of obsessive compulsive disorder. First is we have the obsessive symptoms, that is fear of getting germs, a strong need for other taboo thoughts or aggressive thoughts. Then we have the compulsive symptoms, the excessive hand washing or cleaning, the excessive organizing, ritualistic counting, repetitively checking on things. Lastly is we have the bipolar disorder. So this is a psychiatric diagnosis that includes episodes with both mood changes and altered activity or energy. So in the past, bipolar disorder was called manic depression or the affective psychosis in the 1800s. So this is a serious, often lifelong mental illness that causes serious disruptions in lifestyle and health. However, there are effective treatments for bipolar disorder, and people with this diagnosis can live full and productive lives. Now, let's proceed to learners with chronic illness. So, chronic illness affects at least 10 to 15% of children. So, responding to the needs of students with chronic illnesses such as asthma, diabetes, and epilepsy, that is also known as seizure disorders, in the school setting requires a comprehensive, coordinated, and systematic approach. So, schools can work together with parents, students, healthcare providers, and the community to provide a safe and supportive educational environment for students with chronic illnesses, and to ensure that these students with chronic illnesses have the time or have the same educational opportunities as do other students. So one of the common chronic illnesses of those learners is asthma. So this is a chronic disease that affect the airways in the lungs. So it causes repeated episodes of wheezing, breathlessness, chest tightness, and nighttime or early morning coughing. So during an asthma attack, airways become inflamed, making it hard to breathe. Asthma attacks can be mild, moderate, or even severe, and that is life-threatening. Next is we have diabetes. So we are very familiar of this chronic illnesses. It is also long-lasting health condition that affect how our body turns food into energy. A um, a person who have diabetes, their body either doesn't make any enough insulin or can't use insulin. It makes as well as it should. So when there is not enough insulin or cell stops responding to insulin, too much blood sugar stays in our bloodstream. So over time, that can cause serious health problems such as heart disease, vision loss, and kidney loss. So there are three types of diabetes, which are the type 1 diabetes, the type 2 diabetes, and the gestational diabetes. So type 1 diabetes is thought to be caused by an autoimmune system, or the body itself is attacked by, or the body attacked itself by mistake that stopped your body from making insulin. So approximately 5 to 10% of the people who have diabetes have type 1 diabetes. Now we have the type 2 diabetes. So if our body doesn't use insulin well and can keep blood sugar at normal levels, so this is about 90 to 95% of people with diabetes have type 2 diabetes. The third one is the gestational diabetes. So this is developed in pregnant women who have never had diabetes. So if you have gestational diabetes, or if a pregnant woman have gestational diabetes, their baby could be at higher risk for health problems. So gestational diabetes usually goes away after your baby is born, but it could increase your risk for type 2 diabetes later in life. So those baby or your baby is more likely to have obesity as a child or teen, and is more likely to develop type 2 diabetes later in life too. Next, we have the epilepsy. So this is a chronic non-communicable disease of the brain that affects around 50 million people worldwide. So it is also worldwide, and it is characterized by recurrent seizures, which are brief episodes of involuntary movement that may involve a part of our body, which also known as a partial or the entire of our body, or the generalized part of our body, and are sometimes accompanied by loss of consciousness and control of bowel or the bladder function. Next is lastly we have the allergy. So allergy, we are very familiar of this chronic disease. So it can last for a long time, or it occurs often. So an allergy occurs when the body's immune system sees a substance of harmful and overreacts to it. So the substances that cause allergic reaction is called allergens. So when someone or when a learner is or has allergies, their immune system makes an antibody that is called immunoglobulin E, or the IgE. So these antibodies respond to allergens, and the symptoms that results are an allergic reaction. So the most common allergy symptoms can simply make you uncomfortable. So for example, you have a watery eyes, runny nose, sneezing, a rash or hives. So other more serious symptoms like trouble breathing and swelling in your mouth or throat may be a life-threatening reaction that is called an anaphylaxis. Now, in addition, so what can learners do to have a more supportive learning environment for those students who have socio-emotional disorders and chronic illnesses? So there are 5 things we can do as learners to have a more supportive learning environment for those students who have disorders and illnesses. So one is be kind and patient. Two, offer a helping hand. Three, speak up for inclusivity. Four, learn about the challenges. And lastly, we have celebrate differences. So that's all for today, and I hope you learned something from our discussion, and see you in our next discussion.